Hello everyone, welcome back to this channel. Today we are going to look at challenges in pharmacy practice. What are some of the challenges that you may face in pharmacy practice? So we are going to look at what they are and you may experience them in the community. So the outline of the study today, we are going to look at what's people's perception. How do people perceive? How does the community perceive pharmacy professionals in their community? And then how clinical pharmacies exclusively in patient hospital setting rather than as a primary health care. So we see that clinical pharmacy, we already have a lecture on it. So I request you to check out for that specific lecture. It gives you a highlight because here it is going to be superficial, like so small. And then effects of inadequate training of monitoring prescribers and dispensers, policies in importation and registration, and then awareness of drug information. So how do people perceive the pharmacy profession? How do others see us as pharmacy professionals? Some, they see us as people who are just counting tablets, and then others are seeing us as those who weigh and measure things. Actually, they even have no idea of what you are measuring or weighing. Others may call you as a bunch of shopkeepers, and then we have others, uh, they call you as someone that tells them how to use the medicines and when to use the medicine. Like they tell me how to and when to use the medicine. Then others call you counter prescriber or prescribers. And then not really, you see that the healthcare practitioners, they are businessmen. These people are business ladies and women. I mean, men and women. Yeah. What's your perception about pharmacy profession? What about you as a professional? What do you perceive? You can put this in your comment in the comment section so that we see what you really perceive about the profession, because we cannot have you in groups since you are far away from each other. So kindly put it in the comment section and then we shall be in position to know and probably respond. How clinical pharmacy practice is exclusively in patient hospital setting rather than as a primary care practice. You see that clinical pharmacy, we see the patient population and complexity. We see that patient population is many, and these people are few who are working in the field of pharmacy in the hospital. Always the pharmacy staff in every hospital, they are the minority group. Okay, so you find that you may not have to move out to do the primary care practice since you already have a workload, enough workload at the hospital that you are operating in. Then clinical decision making and drug therapy monitoring. So since it is focusing based or much on clinical decision making, you find that it has to operate in the hospital because that is where you do the clinical decision making and drug therapy monitoring. We cannot move out there and monitor people who are doing okay. You actually have to monitor people who are already on drug therapy. Okay, I'm not saying that maybe when in the community there are no people that are under drug therapy, but you find that they are already monitored automatically, maybe by their healthcare providers. However, we find that we focus much on patients in the hospital setting because we can easily reach them in the wards, in the departments that they are in, and so many other places within the hospital. So we also see that the scope of clinical responsibilities of our clinical pharmacist or pharmacy personnel, we see that it is based on in the hospital setting rather than in primary care. Interdisciplinary collaboration in hospitals, we see that uh, there is always a what we call division of labor, whereby everyone has to do some parts in making sure that a patient gets better. For example, a patient walks in and a patient goes to maybe a consultation room in order they attain a prescription, and then maybe they are sent to the lab. So you find that a lab is a specific department. Maybe they are sent for scan, maybe they are sent for x-ray. So those are also other departments. And then after those investigations are done, you find that a patient is brought back to the pharmacy, and that's also a different department. So for clinical pharmacy to be effective, there should be collaboration between all the departments in the hospital. So when you move out to primary care practice, you find that there is no collaboration or that interdisciplinary collaboration out there, because there you're going to do just a health talk on your patient, educating your patient on a specific area. So you find that for it to be more effective, it has to operate within a hospital setting. So we also look at acute and chronic care focus. So these acute cases come to the hospital. Okay, that's a saying. There is a saying that goes that a patient has to look for the doctor, not the doctor to look for the patient. That's why these patients come from wherever they are, they come to the hospital, okay? They are seeking for medical help, they are seeking for medical attention because they are not feeling well. However, when we move out to the community to carry out these primary care practices, we are giving information to both those who are not feeling well and those who are also like well. Yeah, so you find that the practice will be more appreciated in the hospital setting compared to the community setting. That's why when I was just starting this lecture, I said I refer you to a lecture on a clinical practice. It is like a good lecture for you to understand what we are talking about here. Technological and specialized resources are also found in the hospital. We don't find them in the community, and yet we need to use them. So what are the effects of inadequate training of monitoring prescribers and dispensing? So if we do not train prescribers and dispensers right, what are the likely things we are going to experience? So these are some of them. We are going to experience medication errors. We are going to experience drug interaction and adverse reactions because these people are not trained well. So they are going to mix up things, okay? And they will not consider drug interaction while choosing the medications. They are not going to consider adverse drug reaction while giving the drug therapy to a patient, okay? We are also going to see cases of non-compliance with guidelines and practices. You find that there will be non-compliance exhibited in that specific locality where these people are not trained well. They are the ones to give information for a patient to be in position to comply. But if they are not able, if they are not competent enough, if they are not trained enough, they will be they do not know what to tell a patient so that they comply. They do not know what to do for a patient to be in position to comply to treatment. We shall also see that there will be lack of patient education. We shall not have cases where patients are educated about what they need to do, about prevention of a disease, about maybe maintenance, about non-pharmacological management of the condition. So you find that a patient misses out a lot and it becomes a very big problem. Okay. We shall also have increased healthcare costs. So when there is no compliance or non-compliance, when there are drug interaction and adverse drug reactions, these patients are going to come back to the facility and they are going to use their money. Okay, so you find that the money they are going to use is going to be more than even when they came, like their first visit. So there is going to be increased healthcare costs, compromised patient safety and quality of care. It is going to be compromised. And then lack of professional accountability. These people will not be in position to be accountable of whatever actions they are doing, because first of all, they are not well equipped to perform those specific actions that they are performing. Increased risk of legal and ethical issues will arise because they are not properly trained. Inability to address emerging health issues is a great challenge. And we also see improper medicine management. So the whole background or powerhouse of managing a patient is behind medicine management. If the medicine is not managed well, the patient will walk out without medicine, will be given excess medicine, maybe have an overdose, maybe underdose. So many issues will come up. So you find that the medicines have to be managed well for a patient to receive safe and effective medication that they are going to help this patient to get better. Policies on importation and registration of medicines, you find that these people, the prescribers and dispensers, are the ones to form these policies, to bring these policies on board. But if they are not well trained, they have no idea of which policies are necessary for importation and registration of medicine. So we shall end up getting more issues of drug abuse, and even these issues may go unnoticed because no one knows, like, when should we categorize a specific condition to be as a result of drug abuse. Okay, so this brings us to the end of this lecture. Thank you so much for listening, and keep tuned to Grow Farm Academy. In case of any questions that you're having, kindly put them in the comment section and we shall be in position to reach out to you at any time. Thank you so much. Keep blessed.